This is a typical patient. You can see that we're missing a second premolar. Again, it seems to be an area of patients that I have a lot of patients missing second premolars, it looks like. But you can see in this patient, even though the bone quality looks good and our CBCT showed that we had good quality and quantity of bone, in this osteoporotic patient, the ISQ value is 64. While that's a pretty good number, it may, according to the study that we published in 2016, this is maybe not the best in terms of immediate or early loading or even one-stage placement. And so we elected to place this as a two-stage, and the ISQ value at the time of placement really helped my confidence in terms of how I should really handle that and how I should approach that. Because certainly the worst thing that you'd want to do is do it as a one stage and then potentially have a failure in a patient where there was not necessarily an aesthetic or functional demand and real reason or impetus to do this as a one stage procedure. And so if nothing else, the ISQ value gives you that confidence to say to the patient, the number is a little lower, and because of your osteoporosis, I do want to do this as a two-stage protocol, and then you have an objective measurement to help you back that up. And then, of course, at the time when we went back to uncover the implant and we delivered a provisional restoration, it had increased to 71, and this was after 8 weeks of healing. And so, again, certainly giving us confidence that that has increased.